Hello and welcome. Today we're diving into the world of ophthalmology to explore a fascinating and somewhat rare eye condition called Terrien's marginal degeneration. This condition affects the cornea, the clear front surface of the eye, and while it's not as well known as some other eye diseases, understanding it is crucial for both patients and eye care professionals. So, let's embark on this informative journey to learn more about Terrien's marginal degeneration. The exact cause of Terrien's marginal degeneration remains elusive, making it somewhat of a mystery. While the etiology is not fully understood, most experts believe it's likely multifactorial. This means that a combination of genetic predispositions and environmental factors may play a role in its development. There is no known association to systemic conditions, though inflammation is involved. Now, let's delve into the pathophysiology, or what's actually happening in the eye with Terrien's. In Terrien's marginal degeneration, the cornea undergoes a thinning process, primarily in the peripheral, or outer region. This thinning is non-inflammatory, at least initially. A key characteristic is the presence of lipid deposits, fatty substances, in the corneal stroma, the middle layer of the cornea, near the area of thinning. This process can lead to an irregular corneal shape, known as astigmatism, which in turn can cause blurred or distorted vision. Terrien's marginal degeneration is considered a relatively rare condition. While precise numbers are difficult to pinpoint, it's estimated to affect a small percentage of the population. It typically presents in young adults and middle-aged individuals. Though it can occur in a broader age range, there's no known racial or ethnic predisposition, and it seems to affect men and women equally. The signs and symptoms of Terrien's marginal degeneration can vary depending on the stage of the condition. Early on, many individuals may be asymptomatic or experience only mild visual disturbances. As the condition progresses, common symptoms include gradual blurred vision, increased sensitivity to light photophobia, and the development of irregular astigmatism. The thinned cornea can also be more susceptible to injury. A characteristic feature is the clear area separating the thinning from the limbus, the border between the cornea and the sclera, or the white part of the eye. In some cases, spontaneous corneal perforations, or ruptures, can occur in areas of extreme thinning, although this is rare. Diagnosing Terrien's marginal degeneration typically involves a comprehensive eye examination by an ophthalmologist. The doctor will carefully examine the cornea using a slit lamp, a specialized microscope used to view the eye in detail. Corneal topography, a mapping of the corneal surface, is also a very useful tool in identifying the characteristic irregular astigmatism and thinning patterns associated with the condition. Pachymetry, which measures the thickness of the cornea, can help quantify the thinning in the affected areas. No specific blood tests or imaging are typically required for diagnosis. While Terrien's marginal degeneration doesn't have distinct subtypes in the traditional sense, it's important to recognize the variability in its presentation. Some individuals may experience slow, gradual progression over many years, while others may have a more rapid and aggressive course. The degree of thinning and the extent of astigmatism can also vary considerably from person to person. Furthermore, some cases may be unilateral, affecting only one eye, while others are bilateral, affecting both. The management of Terrien's marginal degeneration is primarily focused on alleviating symptoms and preventing further corneal damage. In the early stages, eyeglasses or specialized contact lenses, such as rigid gas-permeable lenses, can often correct the astigmatism and improve vision. As the condition progresses and thinning becomes more pronounced, surgical interventions may be necessary. These can include partial or full-thickness corneal transplants, also known as penetrating keratoplasty or lamellar keratoplasty, to replace the diseased corneal tissue with healthy donor tissue. Other surgical techniques, such as crescentic resection with or without a lamellar graft, can also be used to stabilize the cornea. Lubricating eye drops can also provide comfort and prevent further drying. Currently, there's no known way to prevent Terrien's marginal degeneration, given that the exact cause remains unknown. However, individuals diagnosed with the condition can take steps to protect their eyes from further injury. This includes wearing protective eyewear during activities that pose a risk of trauma to the eye. Regular eye exams are crucial for early detection and management of the condition. The prognosis for individuals with Terrien's marginal degeneration is generally good, particularly with appropriate management. While the condition can lead to visual impairment, if left untreated, most patients can maintain functional vision with the aid of glasses, contact lenses, or surgical interventions. Recent research has focused on refining surgical techniques to improve outcomes and reduce the risk of complications. Advances in corneal imaging and diagnostic tools have also enhanced our ability to detect and monitor the condition more effectively. Furthermore, There is ongoing research to better understand the underlying causes of Terrien's marginal degeneration, which could pave the way for more targeted and preventative treatments in the future. Remember, regular check-ups with your eye doctor are essential for maintaining optimal eye health, especially if you have been diagnosed with this condition.